in the tub. All right, we switch gears now. On Thursdays, we always talk about things from the medical community. Today, we're bringing in Dr. Borden Hooks, a surgeon with New Hanover Regional Medical Center. Is it like nails on a chalkboard for you guys when you hear studies say, and it ends up being a medical thing?
Well, you just have to be careful about where the study comes from. They can take numbers and make them look pretty. You
can always make numbers say what you want them to say. This morning we're going to talk about hernia surgery. If anything ever happens with me related to this, I had 2 hernias as a kid. So one of the things I wanted to ask you right off the bat was, is this age specific, or is this going to run the gamut of your life that you're really a candidate for this?
Well, hernias by definition are a very broad term. So there are multiple hernias, different spots. You can have umbilical hernias and inguinal hernias as a child. You can have those as adults as well. Anywhere you've had surgery before, you can have a hernia. And essentially a hernia is just an opening in the musculature part of your abdominal wall.
And then I guess it's something can slip through that opening, and that's where the problem
hernias
can be.
Become dangerous. Small hernias that are reducible and aren't tender generally are not dangerous. We consider watchful waiting in those kinds of hernias. However, as hernias get bigger, they become more difficult to fix. They also have the risk of having, intestinal contents stick in the hernias.
As far as the surgery itself, again, I'm 48 now, so this is years ago when I had mine. I'm going to assume advancements have come. As far as turnaround procedure, what are we talking about for individuals?
Well, the good news for you is we've got plenty of time for you to develop hernias and for us to fix them. The technology has really come a long way. That being said, sometimes we still fix things through an open incision. Okay. We do a lot more hernias in a minimally invasive approach, both laparoscopically as well as robotically. Most of these hernias are going to have us placing a piece of mesh in between your abdominal wall layers to help keep the hernia from coming back. There's a lot of information out there about, bad mesh, yada, yada, yada. Sure. The mesh we use is very tried and true. It's very safe. We put it in a safe place. And so generally what that does is help prevent those hernias from coming back.
And this is a very common procedure, correct?
Oh, absolutely. I think probably one of the top 2 or 3 procedures we do as general surgeons are going to be a hernia repair in some form or fashion.
All right, as I always tag out with this, again, if you have questions, I wear blue coats at work. He wears the white coat or scrubs. Always contact your physician with any questions.
Okay.
Dr. Hooks, thank you very much.
Thank you very much.
We're back with more after this.